Bell Flint joins us now to talk about the flu, and if you have questions, you can send them to the doctors at WLBT.com.
Thank you, Maggie. Joining us is Dr. Timothy Quinn, who is a general practitioner. Thank you so much for joining us. And the flu is here.
Yes, it is. Yes, it is.
You're seeing flu now?
Yes. The main point that I want to stress is the fact that the flu is a virus, and if someone were to contract the flu, they want to be diagnosed early. The most common medication, Tamiflu, is very effective, but it only works if the flu is diagnosed and the medication is started within the first 48 hours of symptoms.
Now tell us about some of those symptoms, because a lot of times we can have sinus infections or just an old-fashioned cold, and we mistake it for the flu.
Right. Well, the main point is when you get the flu, if someone were to get the flu, their immune system is weakened because the body is trying to fight off the flu virus. So there are a lot of cases where an individual might contract the flu and at the same time have a bacterial sinus infection.
Wow.
But the most important point is if you have any symptoms of cough, runny nose, fever, fatigue, go ahead and get checked out, because the only way to effectively treat the flu is to be diagnosed early. I have a lot of patients that might come in and they'll say, well, I've been sick for a whole week, and we'll diagnose the flu, but it might be too late. And if you start the medication, as I'm emphasizing, it really doesn't work after the first couple of days.
So are you still giving the flu shots, and at what point is it too late for the flu shot to do you any good?
It's never really too late to do the flu shot. You can do the flu shot because what the flu shot does is it helps your body protect you if you come into contact with the flu later. And if you haven't contracted the flu this year, it's not too late to get the flu shot, because you might come into contact with the flu 2 or 3 weeks from now, and because you got the flu shot now, that would help protect you.
Well, a lot of people were exposed to the H1N1 swine flu last year, and some got sick, some didn't. Some were diagnosed, some weren't. Does that give them some added protection this year?
Oh, yes.
Just normal, natural immunity to it?
Because if you've been exposed to a strand of the flu, your body will produce antibodies. So if you come into contact with that same strand again, you will theoretically have some protection.
Now, I have a question, and it kind of pertains to the flu, and in one way it doesn't. But it seems that people that work around small children, or when you come in contact with small children, you tend to get sicker, or you tend to get sick more often. Is that true, or is that just in our minds?
No, actually, small children, they have a less strong immune system. So there'll be a higher prevalence of carriers of the flu, different types of bacteria. So if you come into contact with a great deal of small children, such as a teacher or a healthcare worker, you'll be theoretically exposed to more viruses and bacteria, so therefore you're more likely to get sick.
Plus they touch everything.
Yes, they
and
do.
put everything in their mouth.
Yes,
too.
they do.
I was about to say that.
So maybe you can't necessarily avoid it altogether, but what can you do to possibly get around getting the flu?
Well, the most important thing is, you have to live in reality. You're going to come into contact. I mean, me as a physician, I come into contact with sick people all day, every day. But the most important point to take home is if you start to develop any symptoms such as runny nose, cough, headache, fever, go ahead and get checked out and, get a flu test by a physician, because if you get diagnosed early within the first couple of days, we can prescribe medication and you can feel better a lot sooner and a lot more effectively treated.
Yeah, because people are becoming resistant to Tamiflu, so you can't give that if it's not within that window, right?
Right, because we don't want to increase resistance in the community. That's exactly correct.
All right, Dr. Timothy Quinn, thank you so much for joining us and talking about this today.